Data collection method in nursing research. Data collection method in nursing research. One thing I usually say is that without data, there is no research. For you to answer some research questions, you must collect data, or you must gather information about that particular research question. So, and in nursing research, we are also researchers, and we need to collect data so as to answer some nursing research questions or solve some nursing research problem. So data collection can never be underemphasized in research. Some of us will just collect, collecting it just halfway. At the end of the research, your findings will not be trustworthy. Your findings will not be reliable. So that's why you, as a nurse or a nurse researcher, you need to have the knowledge of data collection methods. By the time you establish some research questions, those research questions will help you to identify what type of research instruments should you use to collect your data. So we don't just select research instrument. Most of us are used to questionnaire, even if our research question is tilting towards qualitative research, where we are supposed to use interview method or focus group discussion. We tend to panel beat our research questions to look like that which can be, captured, which we can get the information through questionnaire, because we felt questionnaire is so easy and, but that would affect the credibility of your research findings. It will affect the trustworthiness of your research findings. Not just that, your research will just be like a trash. No one will use it to generalize or make any policy changes. So that is why we have to make sure that whatever data collection instrument we are using is effective and efficient for that particular research we are conducting. So the learning aim and objectives for this particular presentation. The learning objectives, these are the objectives before us. We just want to introduce the key data collection method that are usually being used in nursing research. Then how can we identify and justify a standardized questionnaire? Sometimes we tend to use some questionnaire that are or standardized instruments. How can you identify them? Then we are also going to explain how to conduct a pilot study, and also revise the instrument, because most time after pilot study, if there are any changes that need to be done on the instrument for it to be reliable and valid, we will need to do that. That's under revision of research instrument. Then principles of reliability and validity, and how can you assess them. Then we're also going to address common challenges in data collection. All right. The next slide. Why data collection matters? Why is data collection very important? I think I have captured this one when I was doing a preamble initially. The quality of your data directly determines the quality and trustworthiness of your research findings. So I've said that earlier, that if you use the wrong instrument for data collection, you collect a data or informations that are not that is not valid, that's not of high quality, and at the end of the day, the information you collect will affect the quality of the research findings. So that's why data collection matter most in research, so that we collect effective quality data and quality information that will be, that will justify or that will give us a finding that is trustworthy. That means a finding that can be used in making policies, in making decisions about educations, about care, among others. So that is why your data collection is of very, very important. So, and for you to be known as a researcher, for you to do a very good research, you need to collect a very quality data using the right and appropriate instrument, so that your findings will be credible and will be trustworthy. Next slide, sir. All right, overview of data collection methods. Data collection involves gathering relevant information to answer a research question or solve a problem. Look at the word relevant information. That implies that there are information that are not relevant. So we need not to collect such kind of information. For data collection, let's say your questionnaire, you should know what to be included, so that you capture and collect the information that are relevant to your research question, either the question or to solve the problem. So if I am looking for information on, let's say, MCH, and I am asking a question that is tilting towards psychiatric, that in particular might not be relevant in that context. So we have to collect relevant information that will answer our research question and solve the problem identified, because it is the problem that lead to the research. So from there, we now generate questions that we need to answer, which will help to solve the problem. So what are the categories? We have these three major categories. We have quantitative methods. That is quantitative method. Here we talk of numerical data. When you talk of quantitative, you are talking of data that are, that you can count. Quantitative, that can be in form of numbers. So you collect numerical data, which will be analyzed statistically. So an example of instrument here, we use a survey or questionnaires. Questionnaires is either you tick. At the end of the day, we have a table, frequency distribution, then we calculate, analyze via statistical, maybe the use of SPSS or other statistical measures like Excel. So quantitative method. Then we also have biophysical measurements. These biophysical measurements are issues like, sometimes we can measure the blood pressure, weight and others. So they are all quantitative. Sometimes you need information like that to, answer certain research questions. So they are a way through which you can get quantitative data. Then we also have structured or quantitative observation. Most time when you hear about observation, you may think it's only qualitative, but no. we have structured or quantitative observation where we use our checklist. Like I can just have a checklist of what I want. So I will just go, observe and tick. Observe and tick. So a checklist is also, it falls under quantitative method. Then the second category is the qualitative methods. Quanti and quali. Qualitative is all about textual or descriptive data, that you use to understand meaning and experience. So there are some things, some information that you cannot quantify them. All you need, if you want to know about people's experience, people's feelings, most times these informations are very difficult for you to put them in form of quantity. So it is very, very okay for you to collect such kind of information through qualitative methods such as the interviews, focus group discussion, then qualitative observation. This qualitative observation, usually we do have maybe participant observation where you be one of them and you observe and get the information that you need. Then the third is record/document analysis. This particular one, for those of us that usually conduct research that maybe look into previous record or previous documents, this is what we are doing. Our research is, the method is captured under record/document analysis. Like if you want to calculate let's say the prevalence of, a particular disease among, say, women attending antenatal clinic, let's say in Ahmadu Bello University Teaching Hospital, within a particular period. All you need to do is to visit the unit, get the record, and go through the record within that period you want, get your information. So that is document analysis. Even though at the end of the day, you analyze it statistically, so as to drive out the meaning of what you want from such data or information collected. Thank you. Please, are we following?
Yes, sir.
Yes.
All right, thank you.
Yes, sir.
Yes, sir. Thank you. So the next slide. All right. Well, let's look at some of these methods. We just talk about quantitative, qualitative, and document analysis or record analysis. So for quantitative method, the first one there is survey and questionnaires. I know a questionnaire is not new to most of us. That's very, very common during undergraduate research and undergraduate studies. Most of our work, usually questionnaire, or some of us who may want to go away from questionnaire, we do document analysis for those that calculate prevalence or incidence of whatever. So you tilt away from questionnaire. So, but majorly, if I may say, 90% of most of our undergraduate research, respondent will react to. So there are a lot of questions that the respondent will react to. And those questions are they are the information you want. They are what you want to collect that will help you to answer the research questions you have established. So you look at your research questions, you look at the problem, then you design your questionnaire. Even if you want to adapt, you are going to adapt in relation to your research questions and even the statement of problem you want to solve. Okay, so then Questionnaire is used to collect information on facts, behaviors, knowledge, attitude, beliefs, and sometimes, not even sometimes, always opinions. Opinions. So you may want to collect information on people's opinion about something. So you can use questionnaire. You may want to collect information about people's knowledge on something. You can use questionnaire, attitude, and all those beliefs. Some of those things, some of this information can be collected by the use of questionnaire. So we have types of data to be collected, which I've just said. Factual data, you have demographic information, personal history, behavioral, that is actions, habits, and lifestyle can also be collected. Then attitudinal, opinions, beliefs, and values. You can all collect these information from by the use of questionnaire. Sorry. All right. Next slide, sir. All right. The second method, which is also a quantitative, is the structured observation. Okay, they are like two methods together: structured observation and biophysical measures. So a structured observation is you use a checklist or an assessment tool, which you will just be ticking and ticking while observing. So it's a systematic watching and recording of behaviors, stroke, events, using what? A predefined checklist or rating scale. So, like, if you want to, okay, if you want to look at, okay, let's say, instructional technology, let's say you are doing a research on maybe instructional tech, or so you have a list of instructional technology, maybe in a school of nursing within a particular environment. You have, if you want to observe, you can use checklists. Go and say, okay, did they have this? How many did they have? Did they have that? How many you have? So you have a checklist. So as you tick, then at the end of the day, your checklist will have a rating scale. So that's structural observation. Is more of, it's also quantitative because you are ticking and ticking, and it's also number based. It's not factual or textual based. Okay. So here we have violent assessment tools. If you want to do violent observation, so you can, when you search for this assessment tool, you have it. So you go to wherever you want to observe and you tick and you have the information collected. Then checklist, you can have a checklist about a particular thing you want to study, then go and observe systematically, then you tick and collect your information. Then the biophysical measurements, collection of objective physiological data, which I told you about, blood pressure, lab values, pain. You can collect information on pain, even though pain is more of you cannot quantify it. It depends on the patient itself, and that is why most time we can use visual analog scale. This visual analog scale is like you just ask the person on a scale of 1 to 10, rate your pain. You can have a scale, maybe a kind of ruler or a kind of diagram. You write 1 to 10 or 1 to 100. Then you ask him to rate the level at which his pain is. So he will use that. So it's more of quantitative too. So it is the person who is feeling the pain that can tell you the level of the pain he or she is feeling. So you can use that. So and get quantitative information that can give you information related to pain. So this biophysical measurement, the measurement could be anything within the body or even in an artificial environment. So you can do that biophysical measurement. All right. Next slide. All right. We are moving to qualitative method. Qualitative method, we said, is all about textual information where you gather mostly information about people's experience, among others. Okay. So qualitative methods, we have interview and focus group discussions. So in-depth interview, here you explore people's experiences and meaning in details, experience they have and the meaning in details. And this can be structured, semi-structured, or unstructured. You understand? So you have what we call interview guide. The interview guide can follow a very structured pattern. As if we are talking of structured pattern, the way you ask the question follows that pattern. Or you have a semi-structured where you ask 1, 2, 3, then you ask the other one. Or unstructured. The unstructured, you just interview the person, not following any form of pattern, but as the discussion is coming, you are the research questions you want to answer, or even could be able to help solve the research problem you have identified. Then we have the focus group discussion. Here is just an interactive discussion. In this method, you have at least 8 to 10 participants where you want to explore their norms and values. You want to explore their shared experience and generate ideas. Like if I want to do a study among, maybe a study that I want to explore the experience or experiences of university students so as to generate ideas that is related to my research question. What I will do is, if you have 8 to 10 participants that are sharing the same characteristics, that's why you have shared experience. That's to say that you cannot group people with people who are not sharing the same characteristics in the same group. At the end of the day, you may not likely get the information you want to get. So you group based on your, let's say, is it the participant now, your settings, okay, or your study, your target population. If you are doing if your study is covering a lot of categories of people, you look at, okay, this category A could capture this kind of people. You make them into a group, so you can do a group discussion. So whatever they are going to be saying will be similar because they have a shared experience. So you get your information on that part. Then you look at category B. This, and this person can be in category B. So you get the discussion going. Then you collect your information. But the only disadvantage that this particular method usually have is sometimes we have some people that are highly vocal. So the extrovert now, they will overshadow the introvert. So that's one of the shortcomings of focus group discussion. But at least you can try and minimize that shortcoming by ensuring that everybody participates, without leaving some people out. Don't just focus on that particular person that is always answering. Try and see how you can touch every one of them so that you can get their experience then so that your data or the information collected will be trustworthy. So the researcher, that is in when you're collecting data or information via interview and focus group discussion, you, the researcher, you are the primary instrument for data collection. So you are the primary instrument for data collection. So you will be the one who will be asking the question, who will initiate the interaction, while you are recording. Okay. All right. Next. Next, sir. All right. Thank you. So we have observation and document analysis. Observation and document analysis. Observation and document analysis. Document analysis is the third subcategories. So don't be confused about it. It's not under qualitative. Okay. So participant observation. Here, the researcher immerses in the natural setting in order to what? To understand the context and the meaning from the participant perspective. You just go in, okay, I want to get information about, let's say, Redeemer University student, and I don't want them, if I should come and I'm observing what you people are doing, you can tend to hide some of your characters. Say, this man is observing us, so let's try and hide some of our attributes. So the best thing is to go by participant observation. I'll just enroll in the school, be like a student, behave like a student, and I'll get my information collected. So that is participant observation. It's usually it's usually recommended when you are doing qualitative. You don't just do observation. Personally, like me, if you come to observe me, I will change some of my attitude. Maybe I'm highly aggressive and you want to know. I'll become so kind and so nice. So at the end of the day, your findings will not be reliable. So most time, it's usually good for us to do this particular participant observation if we want to collect qualitative information. So as they are talking, as you are interacting with them, they will know that you are recording it. So they will give you the information raw, the way it should be. They will not cut it down. Okay? If you want to observe some things about criminals, the same thing too. You go by way of participant. And I think this is what some of these CIDs, some of them will go in this context, and they will get whoever they want to get and get the person arrested. All right. Then document analysis. That is systematic examination of existing text, like patients' charts. We have patient chart in the hospital. Maybe the charts about a particular thing in the hospital, diaries, policy document, patient record, you understand, among others, in order to gain historical or contextual insight. So, if I want to do research on prevalence of let's say, malaria among women of childbearing age in Ahmadu Bello University Teaching Hospital. Prevalence of malaria among women attending antenatal clinic in Ahmadu Bello University Teaching Hospital. All I need to do, women attending antenatal clinic are pregnant women, within which period, maybe for a period of 3 years, between 2020 to 2025, if possible. So I'll just go, get the record, check through and see, then get my information, all the information I need that will answer my research question. I'll get them out, then analyze them, and they will answer my research question. Or maybe if you want to do some research about certain policy, you can review policy document, and you get some information. You can even do some systematic analysis, to arrive at certain you can do this systematic review most time. You review them, and you end up having an insight about that particular issue. All right. How do we select a method? What are those things that we have to consider if we want to select a method? That is the key criteria for method. That is, if you want to select which method or which instrument should you use, how, what are those things you have to put at the back of your mind? One is the nature of research question. Nature of research question. If your research questions are usually what is blah blah blah, how is blah blah blah, I think you look at your research questions. These my research questions, are they actually going to, can it be properly answered if I select quantitative method or qualitative method? Okay, if it is quantitative method, what kind of instrument will be suitable for it? Then if it is qualitative, what kind of instrument will be suitable for it? So you look at the nature of your research questions. What do you want to know? You ask yourself. So by the time you answer that question, what you want to know, it will begin to, your mind will begin to, it will begin to become clearer in your mind what method should be used to arrive at what you want to know in order to get the information about what you want to know. So that's the first thing you have to do. Then second thing that will guide in selecting is the type of research study you want to do. When you want to do research study, you definitely know that, okay, this particular research study I'm doing is a quantitative research, or this one is qualitative research, or this one I'm doing is mixed method. So you look at what type of research am I doing. If it is quantitative research you are doing, then your instrument for data collection should be purely instrument that can collect quantitative information. And if it is qualitative, same as what is obtainable in quantitative, your instrument should be that which will help you to collect information about qualitative. Then if it is mixed method, you look at, okay, what instrument, okay, I can use questionnaire and interview because it's mixed method. So the type of research you are doing is also going to help you in selecting the type of instrument for data collection or the type of method you will use in collecting data. Then number 3 is characteristics of the study subject. Characteristics of the study subject. Your study subject are your study participants or your respondents. What are the characters? Their age is very, very important. The level of literacy is important. Culture is important. Health status is important. Among others, there are a lot of things you have to see, observe under characteristics. You understand? If I'm not literate and you are giving me questionnaire to read and tick, you come back and meet your questionnaire unticked or unchecked. You understand? So that is another very important thing that you should consider. Then the culture, what are those things that you can collect by virtue of the culture? Is the culture highly sensitive that you can't collect this information one-on-one, or you can only collect this information via sending instrument or what? So you check. The age is also important. The age of whoever you want to study, the subject, is very important, and even their health status. So the characteristics of the study subject is very vital. Then another very important thing is resources available. Do you have the time? Because if you don't have enough time and you pick an instrument that you need to do it exhaustively, then you waste time and time will be against you. That's one thing you have to do. Then the budget too. The budget. Then the personnel. Who are those that will help you? What are their levels? What are their strengths? Can they do it? And for those of us that who may likely want to recruit maybe research assistants, so those are the personnel we're talking about. You understand? Then the equipment available, it's also going to be one of those things that you will observe. So resources available will help you to also determine or to select the method. Then the researcher's knowledge and competence. If I am not highly knowledgeable in the use of, let's say, in using interview, then it will definitely affect my findings if I use interview to go about collecting data. So you look at your knowledge. Can I actually do this thing? If you're not knowledgeable, you can go back and study so as to what? So as to get the knowledge about that and be highly competent, before you venture into it. So your knowledge is important. And if you discover you have shorter time and you don't have knowledge about it, you look around and see which method can you use that will help you to still arrive at the end point that you want to get. So that is that. So before I move further, any question? Or are we following?
Yes, sir.
All right, thank you. I just want to be sure that I'm not speaking to myself alone. All right.
Yes,
So,
I have a question, sir.
okay.
Sir, when you said observation that we immerse ourselves in a location just to watch them
Yes,
and then to get data from them without their
yes,
knowledge, is that not
yes.
against like ethics? Is it allowed since we not get their approval and they're not aware and we are just collecting the data?
All right. It's one of those things that I'm going to still treat here, but let me just respond to that. Before you do any research, there's what we call ethical review committee. As far as you have an ethical clearance, I think it covers that. So you can go in, observe, and get your information. Okay?
Oh, thank you so much, sir.
All right. Thank you. Okay. So let's move further. So I want us to look at standardized questionnaires. Standardized questionnaires. So most of us we would like to use an instrument which has been used or which was developed by somebody who used that particular instrument maybe in a different setting, but on a similar uh, uh, let's say similar participant or similar respondent. So you can use that kind of instrument. Those instruments are standardized. Why? Because all their psychometric properties have been established. They are highly reliable. They are valid. You understand? So all you need to do is get the instrument, then use them. And when you get a standardized questionnaire, it's either you adopt it the way it is. Adopting means you are going to use it just
Sorry, Mr. Jai,
verbatim.
somebody's background is really disturbing the class there. Admin, please, can we
Yes.
take care of that?
Sophia.
Oh my God.
All right, thank you. So I was actually trying to talk about standardized questionnaires. You know, sometimes you have some instrument or questionnaires which has been used somewhere, and those instruments they already have established psychometric properties. They are having their reliability has been tested, validity has been established. So they are standardized instrument. All you need, if you can, search for such instrument, all you need to do is just to administer. If you don't want to adapt, maybe particularly, let's say I'm doing a research in let's say among nurses in Nigeria concerning one particular concept, and someone somewhere carried out an experiment or a research, sorry, among nurses, maybe in another country, covering similar concept. All I need to do is just get that instrument, because that instrument is a standardized instrument. I will check some of these psychometric property, and I will make sure that the properties they are high, which we are still going to look at those psychometric property, reliability and validity. So if they have an acceptable psychometric property, those instruments, you can use them. If you want to use, it's either you can adopt directly, that is use them from A to Z, or you you adapt, you change some things which are not going to some information that you feel they are not relevant, or you feel you can just modify, you can change them and put one or two things that captures the environment where you are, or those informations that are not in that instrument you just sort for, then you put them. That is an adapted standardized questionnaire. But if you adapt it, you still run the reliability and validity test. But if you adopt and use it A to Z, you may not necessarily need to run the reliability and validity test. So the major advantage about this standardized questionnaire is it allows for comparison of results across different studies and population. So that's the major advantage. So justification for your use, you must justify your choice in a research proposal by demonstrating that the instrument is fit for your study, but that is your study construct, population, and purpose. You just have to just explain that, okay, I use this particular standardized instrument because it was used on a similar population, and the aim is also similar. Things like that. You have to just justify. You just have to justify why you are using that standardized instrument in the study. All right. Mr. Jerry, the next slide is finding and evaluating standardized questionnaire.
Yeah, that's where I am.
Okay, but it's not displaying. I don't know. Maybe the students are not seeing it.
I can see it, sir.
I can see the screen, sir.
You can see the screen, sir.
Yeah, the screen. Yes.
Can you see it now, sir?
Not up till now, sir.
Oh, I think it's your network, so maybe you.
But no problem. The student, are you seeing it? If they are seeing it, I'm fine.
Yes, sir.
Yeah.
Yes, I can.
Please, are you seeing it?
Yes, sir, we
Yes,
can see it.
Please, are you
Yes, sir.
you are seeing it, right?
Yes, sir. They can
All right,
see
so
it.
let's move on. Okay, I can't see it, but let's just move on. So, finding and evaluating standardized questionnaire. So, how do you find, okay, I can see it now. Thank you. How do you find and evaluate standardized questionnaire? The finding. You just go to databases. You go to cumulative index to nursing and allied health literature like CNALD, PubMed, PsycInfo. So when you go there, you use keywords like scale/questionnaire. Then when you search, it will help you. Like, okay, or you can even just go to the database and look at the kind of study you want to do. You may come across a questionnaire that has been used, that is very related to your study. So if you get such kind of questionnaire, you can now download them, evaluate, and you check the psychometric property if it is stated there, because that's the most important thing. The psychometric property is very, very important. I cannot just pick an instrument that the reliability and validity is not there. I can't just pick them and start using just for me to assume that it is a very reliable and valid instrument. No, that's not how it works. So you have to check for that. So that is the evaluation checklist. You have to do the psychometric strength. You have to check for it. If the psychometric strength, that is the Krumbach alpha, is greater than 0.7, that is 0.70, that is either greater than or equal to, I think such instrument is highly reliable. Can be used. Okay, can be used. So such instrument is reliable to be used in your study. Or sometimes you also check for the validity index. If it has a validity index of 0.8, then you can use that. Okay, so that's how you do that. You check out, once you get the instrument on the database, you study the instrument, check for the strength, that's the psychometric strength. Then you look at it, if it's actually on this level, that's the reliability greater than 0.7 or equal to 0.7, then the validity either around 0.80 or sometimes 0.70, then that is the validity index. Then you can use such instrument. Either you adopt or you adapt. So you also look at the conceptual content of that instrument you want to use. If I'm doing a research on maternal and child health, and okay, let me say, if I'm doing a research on, let's say, community health, and the content or the concept that the instrument look upon is not related to community health, then such instrument, when am I evaluating it, even if the psychometric property is, property, that is the reliability and validity, are very good, I will discard such instrument because the conceptual and content does not fit into what I am trying to look for. Then you look at your population appropriateness. Was that instrument used successfully with a similar sample? It actually does not mean the sample must be this. It must be the particular sample you are working on, but a similar sample. Nurses generally, whether you like it or not, we have a particular trait. We have a particular professional ethics, or professional attribute. So if an instrument was used on nurses in UK, and I'm trying to do a study that covers certain concept which they also covered in that research in UK, I want to do that research in Nigeria, I can use that instrument because the instrument was used on similar sample nurses, and I'm also doing my own on nurses. As far as the content fit in, is exact with the content of what I'm looking at, and it has a very good psychometric property, then it's good to go. Then another thing is the length. Okay, the length and okay, that's the practical, the how the length and the cost. How practicable is it? Sometimes you pick an instrument that uh, it will take a longer time for you to gather your information, or the instrument will cost you something. Maybe when you collect data to analyze, will be so. Those are some of the things. The scoring complexity, is it the one you can handle? If you cannot handle, please discard such instrument. Okay, so don't carry something that is more than your strength. Okay, even though most time we look at the first 3 points, the reliability and validity, that is the psychometric strength, the conceptual content fit, then population appropriateness. This one, if you are doing a very thorough research, you may not be concerned about the cost, the length. All you will be concerned about is to get a finding that is trustworthy. All right, thank you. So the next is the pilot study. Pilot study. Pilot study. When you hear pilot study, I know this is not our first time of hearing the word pilot study. Please, what comes to your mind when you hear pilot study? Yes. Who answer that?
Good evening,
Yes, I'm
sir.
waiting for you. I want a response to the question. Good
Good evening,
evening, my
sir.
brother.
So,
Good
pilot
evening,
study,
my
from what I
brother.
understand, pilot study, from what I understand, is more or less like testing uh, a particular research to see if it is really adaptable for a larger population. So we test that using a smaller population size to see how we can, maybe if there is a certain correction we need to do, or if it is actually what we want to run it for. So more or less a
Oh,
testing step.
okay. Thank you so much. Thank you so much. Any other person with different opinion or different view from what he said? All right, thank you. So pilot study is just a small scale preliminary study, a small scale preliminary study, or you can say it's dress rehearse. For instance, if I want to buy new clothes in the market, somehow I will want to wear it and test and see if the clothes fit me, if it is my size or not. So that is dress rehearsal that is conducted before the main study. So I'm testing the clothes in the point of buying because I don't want to wear it out and people will start saying, this clothes is too tight for you. It's not your size. So that is similar to pilot study. It's just a small scale preliminary study that is done before the main study. So why are we doing that? We're actually doing pilot study in order to, check for feasibility of the study, you know, feasibility study so as to test and refine the research element. By the time you do pilot study on a very small scale population, that's a miniature versions, you look at, okay, you you must have developed your instrument, you must have identified the kind of population you want to work, you want to get information from. So you can just distribute certain number of questionnaires. Sometimes we said 10% of your calculated sample size somehow. So you can distribute, then retrieve that. When you retrieve, So if you run the reliability during that pilot study, it will give you the opportunity to see that, okay, when I did this pilot study, this particular part of my questionnaire need correction, need revision. You can, because at the end of pilot study, you still run reliability and you do the validity, so that you don't want to go into the main study, then you begin to identify those problems. So it will serve as a setback. So it's better you identify the setback before you go into the study proper. So that is why we do pilot study. Okay. So it helps us to identify and correct problems that so as to prevent it not to occur in the main study. So that is pilot study. Okay. So what are the key purposes of a pilot study? One, test the feasibility of the overall study protocol. You want to test how feasible it is. Can I run this test or this study on this particular population? Do we have enough respondents to respond to my question? The instrument I have designed to collect information, is it very, very suitable? The research methodology I am using, is it going to be fit? So you are testing how feasible everything about the study protocol is. That is the first purpose. Then second is test and refine the data collection instrument. You see, so you test the instrument, then where you need to correct and refine it, you refine it. You refine it for clarity, timing, and formatting. That's second thing. Then you test data collection procedure and logistics. Logistics is very important in research, so that you not reach halfway and you'll be crying. So test data collection procedures and logistic. Then assess participant willingness and recruitment strategies. If people you want to study are not willing, it's better you change that study to another group of participants. You don't force them to, to participate. So that is why you do pilot study, not when you are at the level of proposal and they ask you. For those of you that will go for masters and other further studies, at the level of data collection, then you now discover that your participants are not willing to give information. You are stuck, and that is very, very depressing. If you're stuck, you cannot go front, you cannot go back. It's very depressing in research. So you have to do this pilot study to ensure that your participant will be willing to give you the information you want to collect, and how do you recruit them, what are the strategies, so that when you want to do the research proper, it will not be new to you again. Then check data entry, coding, and planned statistical analysis. So you look at, okay, how can I enter this data? How can we code it? How can I analyze? So during pilot study, you have idea about this. So the ultimate goal of pilot study is that it saves time. Very important. You don't need to be stuck when you are doing the main study. Then you go back to your supervisor, they tell you that, so far these respondents are not ready to give you information. You have to change your topic. Then that means you are starting from scratch. So the time wasted. So when you do pilot study to save your time, then you save money, you prevent mistake in the main study. So it is very, very important for us to do some form of pilot study. Okay. How do we conduct a pilot study? How do we conduct a pilot study? Next slide. Conducting a pilot study. All right, the steps. The first thing is prepare a draft instrument and protocol. They are draft. Why are they draft? Because they are subject to modifications and change. So you prepare a draft instrument. So you go, when you do the pilot study, you now see that, okay, I didn't actually ask question on this. I didn't actually get information on this. I need to include this. I need to remove this. So that is the first thing. Then you select a small pilot sample. Select a small pilot sample. Some scholars will tell you that maybe 10 to 30, while some will tell you 10% of your study sample size participant is okay for you to do pilot study. But mind you, from a similar population, not your pilots, your piloting is not done on those people you want to study. Okay? If I want to study Bingham University student, I will not do Bingham University student. I will not do my pilot testing on Bingham University student. I will look for a similar participant, that is maybe Bayes University student, so I can do the pilot testing on that ground. Because by the time you do pilot testing on people whom you want to study, it's actually not advisable. So you just need to do it on a similar population. Okay. So then you now, after you have selected the number you want to use, then you administer the tool exactly as planned for the main study. So you just go administer, then you do the brief plan. You debrief participant as you do a follow-up, ask questions so as to identify the problem that your instrument is likely having or may likely have. So that is very, very important. At the end of the day, you analyze, you look for patterns like missing data. Okay, yeah, I did not capture information about their level of education. I mean, their maybe information about their relationship with their lecturer. Oh, let me put that one. It's very important. Oh, I left this particular information. So somehow they are missing data that if you did your main research, at the end of the day, you discover that those information will be missing in your main research. So your pilot study will show you that, okay, this particular information is needed. So they are missing data. So you look at then your feedback comments from your the group or the participant. Then how long does it take them to complete it? It's also very important. Or if you are using questionnaire or interview and you keep me for 5 hours because you are interviewing me, that is an issue. So you look at timing too, very important. So all these things will help in conducting the pilot study. All right, thank you. The next slide, sir. Then from pilot to revision, that's common improvements. What do we do at the end of the pilot study? The first thing is rewarding ambiguous or difficult items. If you are doing a research on, let's say, secondary school student, and there are some words or some wording that are very ambiguous and complex, and maybe at the end of your pilot study, you discover that that word is giving all of them problems. So you have to reward it. So you change it, make it simple and not difficult. Then you adjust the formatting, that is the line spacing, the font size for clarity, if there's any issue regarding to that. Then you add examples or definition for complex terms. In some questionnaire, you see they will define what the terms are. You understand? You see them like a key. So you can, if the need be, you can include such things on your instrument when you are revising it after pilot study. Then reordering of questions to improve logical flow. So you can reorder your question from what is your name to how old are you, to what level are you? I think something like that. So the order sometimes matters. It will just be flowing logically. You understand? So if there is need for that, you do that too. Then you shorten the instrument. If you discover that the completion time is highly excessive, so you look at, okay, how can I reduce this question? At least whoever pick my questionnaire should be able to finish ticking or answering the questionnaire within 15 minutes. It shouldn't be 31 hour. How can I reduce it? What are those things that I should knock out? What are those things that I should bring? What are those things that I should do to make sure that the time is not excessive? It's very, very important. Then redefining instruction for administrator and participant, which I have said. Some of the instructions like questionnaire comes with instruction. If the instructions are ambiguous, you can redefine them so that they will know what they are to do. Thank you. All right, next. Reliability in research means consistency, while validity is accuracy. So one talks about how consistent, while the other talks about how accurate the instrument is. Consistency is all about reliability, while accuracy is all about validity. For instance, if for us that are nurses, if you are using a weighing scale to take the weight of a patient, if the patient climb and you weigh the weight, maybe you got, let's say, 10 kg, then you ask the patient to drop, to step down from the weighing scale, you ask him to climb again, and at the end, so that's the same thing that reliability is all about, is consistency. In fact, in research, apart from consistency in as regard to the instrument for collection of data, whatever you are writing chapter 5, you must be consistent. And when we talk of consistency, if I'm writing or making a research on, let's say, childbirth, and maybe along the line in my write-up, instead of childbirth, I'm using delivery, I'm not consistent. So consistency is very, very important in research. So that's consistency. So validity is consistency, and you can see the extent to which an instrument yields the same result on repeated trials. Then that's reliability. Then validity, which has to do with accuracy. How accurate is the research? I mean, the instrument. The degree to which an instrument measure what is intended to measure. If you are measuring something and that instrument capture it, for instance, if I'm developing an instrument, for data collection or a questionnaire, you understand, my questionnaire should be able to measure what I want to get from my study. That's from the perspective, when you look at it from your research questions, okay, what are those things that you think you want to measure from this study? So if your questionnaire cannot measure that, that kind of questionnaire is not valid. So validity is all about accuracy. Is it accurate? Is it in line with what I'm about to study or not? So that is validity. So next. All right. So how understanding reliability? That's the first. That's the first one under those the reliability. How, if you want to, the word reliability is not just is very complex. It's not something that You just say, okay, I get it. It implies the instrument is reliable or is consistent. There are much more to know about reliability. So we have three basic aspects that we are going to hit. The first one is the test and retest reliability. That test and retest reliability is all about stability. It's all about stability of the instrument. Then the second is the internal consistency, that is homogeneity of the instrument. And the third is inter-rater reliability. That's where we have equivalence. So the test and retest, when you talk of test and retest, that one is talking about stability. When you test an instrument, if you test the reliability of an instrument and you test it again, that is test and retest, the reliability must be stable. That is stability. So the consistency of that instrument over time, that is what test and retest reliability tends to establish. Most of the time, we calculate it, we calculate. Here, what you do is you administer this same test to the same people at two different times. That is the test. First, you administer the same the instrument first, you calculate, then second, you administer. So it establish the how stable, the stability of that instrument. The there is what we call the comeback alpha. If when you run the statistical calculation of the test and retest, that is the statistical calculation after you collect the first data, the first information and the second, and you run the statistical analysis of it, it is expected that if you achieve a comeback alpha of at least 0.7 or higher, then you will say that, okay, this particular instrument is reliable. It's reliable. But if it's less than that, statistics cover that there are some things you can knock out of the instrument that would enhance that value. It will elevate that value. In fact, some of the like the SPSS, some will even show you some repetitions, some questions that you have repeated over time that they are not even that relevant. So you can take one out for the other. So by so doing, you discover that at the end of the day, the value will increase. And if that is not applicable, you can now then work on that instrument again, then you re-administer and then you calculate the value again. So that's for the test and retest. But the disadvantage here is that, because it's test and retest, the trait and the attitude of the people you administer at first in the questionnaire to may change over time. That's just the little challenge or challenges that this particular test and retest reliability has. Because if you come today, tomorrow, maybe in the next time you are visiting, some of the traits of your respondent must have changed over that little time, because you have to collect the data twice for you to run that analysis. So that is test and retest. So then the second one here is consistency, internal consistency. So that's the second part of the reliability. So here, what you do, you assess whether all the items in a tool measure the same underlying construct, like all the items in a tool, all the content, the items within the tool. Internal consistency will ensure that, okay, all the items within measure the same uh what your the internal consistency is just talking about how consistent are the items within your instrument for data collection. Are they consistent over time? So that's another reliability test that we normally carry out. So that is internal consistency, and it's also calculated. Is also the same. When you calculate this, you discover that the Krumbach alpha there is either greater than or equal to 0.7. So that is the internal consistency. So you also administer the instrument, then you run the analysis. Then when you run the analysis, that's why you discover that the other one is talking about, that is test and retest, is stability. But here, internal consistency is homogeneity. The content, how homogeneous, how consistent is the item within the tool for the data collection. So that is what the internal consistency tend to establish. Even though most time, in most of the research we see around, what people normally carry out is the test and retest kind of reliability. I was talking about internal consistency. So you also calculate here the Krumbach alpha, statistically, and you have a range, a limit of what is accepted. If you have any value below that, then your tool need to be remodified so that you recalculate to ensure that you achieve that particular value. Either is either greater than or is equal to 0.7. Then there is the third one is the inter-rater reliability. Here we talk of equivalence. Inter-rater reliability is just the agreement between different observers or raters. Like if you're doing an MSc study, for instance, most time before you go into the field, they may ask you to submit your tool or your instrument, that your questionnaire, whatever you want to use to collect data, to 4 different we call them vectors. They will vect the instrument. So I think it's part of what they are trying to establish, even though at the end of the day we don't normally calculate the value, but I believe that's what they are calculating. They are trying to establish. So inter-rater, that is between observers or between raters. So the method is maybe like 75% agreement is acceptable. And most time we calculate Cohen's kappa value to is small is when you have a value that is 0.60. These values are calculated, maybe statistical calculations. They are statistically calculated because this instrument will be rated. Those vectors or those observers will rate it. So you impute whatever they have rated. It may be each of the items within the instrument. Each of the item, they will rate each of the item. So then you impute and you calculate this particular value. So if you have a value that is greater than 6.0, then that instrument is based on inter-rater reliability, is highly established. And sometimes some school of thought calculate it at maybe 1. For instance, if you have 80% from one other person and 80 from the second person. If you look at it, when you divide by that, you have a value that is 1. So, but the most important thing here is that you have raters, two different researchers or people who are skillful or who are authority in that field. They will collect the instrument, they will rate the content, the items within the instrument, then you calculate and you have a value at the end of the day. So if you calculate by percentage, you at least should have at least 75%, which if you look at it, 75% when converted to decimal, you see that is around 0.75, just like the Kronberg alpha. So they are still close to the Kronberg alpha value. So you should have at least 75% agreement between the two. Then if it's the coherence kappa's value you want to calculate, which is established statistically, you have a value that is greater than 6.0. So that is when you will now say that, okay, this instrument is highly acceptable for that research. So by and large, what we normally use, I think the one you see around most times are usually the test of stability and maybe test of equivalence, where even the internal consistency, you could also have that too. So that's for reliability. So the most important thing is, if you're collecting a standardized instrument that you want to use, when you have the standardized instrument, you check all these properties. So you check what is the reliability of that property, of that instrument. That's the Kronberg alpha, what's value. If you see that the Kronberg alpha is like 0.7 or greater than 0.7, and the content, that's where we are going to discuss about the content when we talk of validity. And the content is very, very very similar to what you want to research on. Then you can adopt or adapt that kind of instrument. And if you also design your own questionnaire and you do the test, you should ensure that at the end of the day, your reliability value, that is the Kronberg alpha, should be within 7 and above. So then you will now be very sure that, okay, your instrument is very, very reliable. Then the next one is understanding validity. Validity we said is reliability is consistency, while validity is accuracy. So you want to understand validity, and we have phase validity, content validity, criterion validity, and construct validity. And most of our research around, we see that people usually do, they say phase and content validity. You see, phase and content validity was established. How do you establish phase and content validity, which is the most common one we see around? So phase validity is based on subjective judgment, rather than rigorous statistical proof. In phase validity, you don't subject the instrument to statistical calculation or statistical scrutiny. All you do is, the scholars or the authority in that particular field where you are researching, they will just look at the instrument and rate the instrument. So that is subjective judgment rather than rigorous statistical proof. So this phase validity is usually not a true measure of validity, but at least it's important. It's not a true measure of validity because we just look at it, you glance through it and look at, okay, yeah, the content can measure what we want to find. Yes, the content is accurate. The way the instrument is designed, the flow of the questions is accurate. All those things, they are what is normally done on phase validity. And that's why most time we say face and content, because we believe that submitting it to our project supervisors, when they go through it, they must have effected one or two corrections, and that will may serve as our faced validity. But normally you are supposed to give it out to somebody who is an authority, not just your supervisor alone, some other authority in that field, to go through the instrument and to establish whether that instrument is valid based on face validity. Then the second is the content validity. The content validity. The instrument here, when you talk of content validity, the instrument adequately covers all the aspects of the construct or concept it is supposed to measure. That is to say, if I'm working on maternal mortality, does my instrument, does it covers every concept based on what I want to find out about maternal mortality? Does it cover all the concept or the construct within what I'm studying? So that is content validity. So the content of my instrument should be commensurate with the with the study I am doing. As the content should not deviate from the study I'm doing. So that is content validity. You understand? So here we have expert or panel review. It's just expert and or panel review, where some expert will review, look at the content of of the instrument. They look at it and compare it with what? With the study you are doing, and they will ascertain that okay, the content will actually measure what you are trying to achieve. So we say content is measured by content validity index. This content validity, we can calculate what we call content validity index. And content validity index is usually accepted at this level. 0.80 or higher is acceptable as the content validity index, even though we don't usually calculate that here in Nigeria, or most time in our contemporary research that we do here. So how do you calculate this content validity index? It's simple. It's usually calculated by, you divide the expert rating of an item. Is either they rate the item as relevant or clear. Okay, usually the rating is on a scale of 4 or sometimes scale of 3. You understand? So maybe they rate it, I can rate an instrument maybe 2, 3. The items, that is the content within the instrument, you can rate them one after the other on that scale. So that by the total number of the experts, that is the items content validity index. So each of the items, like question 1 of my questionnaire, if one of the expert may rate it, let's say 2 out of 4, another may rate it 3 out of 4, another may rate it 4 out of 4. So all you need to do is what? You divide this expert rating of those items by what? By the total number of experts. So that rating, when you sum it, you divide it by the total number of experts. Then after you have done that, then you what? Then averaging these scores. So all the scores now for each of the content validity index, you now average it. That means by the time I have 20, let's say 20 questions, and each of the questions or each of the questions was rated by, let's say, 4 experts. When you have question 1, somebody will rate it 2, someone will rate it 3, someone will rate it 4. If they are 4 in number, someone may rate it even 1. So when you add this together and you divide it by the total number of the expert, you have the content validity index for that question as what you have achieved by dividing that. So doing that now, for each of the content now, at the end of the day, you sum everything. When you sum everything now, then you divide it, as you average it. The total score now, you average it by 4. Then you now get your content validity index for that instrument. So that is how to calculate that. This one is just straightforward. You may not need statistical whatever. So you can just do it. If you are submitting an instrument like for vectors, you may request they rate all the content. They rate all the content of the instrument, that they should rate it for you, maybe scale of 1 to 4. So by the time they rate it, then you will do the calculation. You understand? You can do it manually, or you can do it even on your calculator, or in the computer, on Excel spreadsheet as well, and even on SPSS. So at the end, whatever you achieve will be the content validity index. So you can see that what we are doing here, when you see some studies, you see that they say content phase and content validity index was done, but I'm not seeing any figure that is showing me the content validity index, how it was calculated, nothing like that. So what most students are doing, they are not actually doing the content validity, they are doing the phase validity, but they are always telling us that they've done phase and content validity. So you can do content validity if you have authorities who can rate your instrument, then you can calculate and impute that into your study. All right, the third one is criterion validity. Criterion validity. Here, the instruments, the instruments score, that is the instrument score, correlate with an existing golden standard measure. Like, you have a standard, that is the gold standard measure. So the score that your instrument will have must correlate with that standard. For instance, to calculate it, you compare the new test score with the established gold standard score using what we call the correlational coefficients, like Pearson's, that is the R value, the R value, and the R value, to see how the instrument, how the relationship is strong or not, or if they are strongly related. So that R value will indicate. Now, if you have an R value which is equal to +1, that is a perfect positive relationship. This one too is a statistical calculation that is used to establish this. So if you have an R value that is +1, there you talk of positive relationship. But if R value equals 0, there's no relationship. When the R value is equal -1, that is perfect negative relationship. Now, but mind you, R value of 0.5 or higher is often suggested as strong. So if you're doing criterion validity and you achieve an R value that is 0.50 or higher than that, then by virtue of criterion validity, your instrument has a very good and strong criterion validity. Okay, so that's a meaningful relationship. Why, if you have 0.3, you say that the relationship is medium, that is 0.30, and if it's 0.1, then it is very low. So in summary, you should ensure that if you're doing criterion validity, you should ensure that the R value should be at least 0.5 or higher. If you have R value less than that, then you have to work on the instrument and rerun the criterion validity again. So that is the criterion validity. So you are running two things. You want to test the relationship between your new instrument and maybe a gold standard scores. So you want to see how related they are. For instance, let me just say, I'm just using this as let me use a preamble, like maybe there is a statistical standard or a statistical value that is seen as the standard for a particular line of study, and you want to do it. So you can, that value is like the standard. Then when you run your own when you do your test, you test the relationship and see if the relationship between that gold standard item and yours, if the relationship is higher, you should at least have 0.5 or above. But if the relationship is medium, it will drop, and it is expected that you should at least have 0.50 relationship. Then we have construct validity. Construct validity here, we're talking of the is more like, is a bit related to content, even though, you understand, construct validity. The instrument, what we check under construct validity is we'll look at the instrument. Does it accurately measure the theoretical construct it is designed to measure? That is, you are testing abstract concept against theoretical concept, the relationship with other theoretical, the abstract concept and the relationship with other construct. So that construct validity, we also calculate R value here, and is should be 0.5 or higher. So you establish those values statistically. So construct validity, even though it's built over time, is not proven in one go. So it's over time. So in our research, it is usually advisable we can do phase validity, content validity, and sometimes maybe we can do criterion validity, because construct validity is built over time. All right. Then we the next is a practical guide. How do we ensure reliability and validity? Ensuring reliability and validity. Now, for reliability and validity, it's either you have a new instrument which you are designing, or you are adopting or adapting an instrument. So how are you going to ensure that those things are reliable and they are valid? All right, for existing instrument, that is an instrument that is that you have, maybe you search in the database and you discover that this instrument is going to be good for my study. So what you do is you get the instrument, you to ensure that the instrument is reliable and valid, you review the published validation studies. So that's what we have discussed earlier, that okay, if you're using a standardized instrument, you check the psychometric properties. So you are reviewing all those things to ensure that at least those properties are within the range of what the Krumbach alpha for reliability should be at least 0.70 or higher. Then maybe if you are doing if you want to also review how valid it is, maybe the content validity should be at least 0.80 or higher. You understand? And even the criterion the R value should be at least 0.5 or higher. So you review all those things. That's the first thing you will do. You establish that, okay, the psychometric properties, the reliability and validity, they are highly strong and good. That's the first thing. When you tick that, then you should ensure that the population in the study, that's the study where that the instrument you want to use, now you want to adopt, the population in those study matches the population of your study. If you are adopting an instrument which was used among nurses and among, let's say, nurses, and your study is on nursing student, that is not going to be a very reliable and valid instrument for your study, because that instrument was used on nurses, not nursing students. So these are some of the things you watch out for to ensure that, okay, the instrument you are adopting is highly reliable. Now, for new or adapted instrument, the difference between adopting an instrument and adapting an instrument. When you adopt an instrument, you get an instrument that has been used to carry out a study on a similar population to the one you want to study. Then you just get the instrument and you just print it and administer without changing anything about the content. That is after you must have established that the psychometric properties are very strong. Then you just administer the instrument without changing anything within the content of that instrument. Then we say you have adopted that instrument. But when you adapt, you can just change one or two things, maybe some construct within the content of the instrument are not in line with what you actually want to, but some are in line. So you add and remove, or you modify. That is adapted. So that is why we say for new or adapted instrument. And when you adapt an instrument, the psychometric property of that instrument will no longer be valid again. So you have to rerun the reliability and validity again to ensure that you have a value that is within the accepted range. So for new and adapted instrument, you establish the content validity via expert panel, which we have discussed earlier. That is the CVI. You give the expert, they tick, they rate the instrument, then you calculate based on our scenario above. So they calculate that. Then for the reliability, you can conduct a pilot study. Then when you do conduct the pilot study, then you will now calculate the Krumbach alpha to see that, okay, the instrument Krumbach alpha is within the accepted range, which is a stronger accepted range. So if major changes are made, that's I've explained this anyway. If major changes are made, you reassess validity and reliability, most especially for what? For adapted instruments. So for new instruments, you have to run the reliability and validity of the instrument. All right. What are the common challenges that we face in data collection? The common challenges. The first thing is poor method justification. You can't just dive into, just pick a method for data collection and you just start collecting data with it without justifying if that instrument actually is going to be suitable for the study. So that is the problem. So you should simply state why the questionnaire is used. What were the reasons behind why you are using it? And most time we tend to forget that. We just say, this questionnaire that is the best for me. It is simple and I can administer it. It's easy for me, without justifying why you are doing it. So, and in research, it is very, very important. Whatever you do, you justify your action. You give rationale or you give reasons why you're doing even if it's not written, at least within your the frame of your mind, you should know that okay, this instrument I'm using, is it actually the best for this study or not? So the solution here is just what you should link your research questions or variables to the choosing method. That's the research question, is usually what that will guide in, either you adapt an instrument, adopt an instrument, or design a new instrument. So your research question should help you, in doing that. So that's why it is usually very good for you to link the question to the choosing method. That will help you in justifying. So when you link them and you see that, oh, there is correlation and yes, it is the best, then you know that you have justified why you use that. Okay. For standardized tools, you should justify based on the psychometric strength. Okay, conceptual fit. Psychometric strength are the validity and reliability. When you have a Kronberg value of 0.7, or if this thing, if the content validity index is also calculated, if you have a value of 0.80 and above, then you know that okay, the psychometric property or the psychometric strength is very, very good. Then conceptual fit, the concept of that instrument, that standardized instrument you want to use, is either you are trying to use, either you adopt or you adapt, is the concept within that, does it fit your own concept? That is another thing. Then it is justified. You are justified. You can use it. Then another thing is prior use with similar populations, which you have explained earlier. The study that this instrument, this standardized instrument, was used. Was it on similar kind of population that you are trying to study? If the answer is yes, then you have justified the use for that particular instrument. Then the second is weak or skip piloting. Weak or skipped piloting. Some people will they thought piloting or pilot testing is just something you just write inside your document. They will not even do it. That's another issue we have. That's another common challenge that we face in data collection. Because if you refuse to do piloting, then be ready to face some challenges that you during a data collection. But if you had done piloting, you must have discovered those challenges before going into the field, and you will know how to go about or what are the solutions or what you should do to avoid those challenges if you want to collect your data finally. So that is why weak or skipping piloting is is not very important. Okay, so we view piloting as optional, or using it only to get preliminary data. Some of we just view it as optional, and that shouldn't be. So the solution here, you should frame it as an essential things to be done. You frame it as an essential feasibility test. Pilot testing will help you to do feasibility test. Feasibility test will reveal some challenges that you will face. If you're doing feasibility test, you are pilot testing, you will know that okay, I have enough people to respond to my question, so I can do this, or my respondents are ready to respond. My respondents are always available in the afternoon, they are always available in the morning, they are always available at night. Oh, during pilot testing, you must have discovered those things. So when you are going to carry out your main data collection, you just go at the right time. Unlike you just go, why? You get there and they are not available, or they are not even ready to comply. So that is the issue that comes with data collection. At the end of the day, you see that people will begin to forge figures and they will get information that are not reliable. Okay, so that is the thing here. So you should systematically seek feedback. When you do pilot testing, you definitely get a feedback on whether your instrument is clear, burdens, the procedures. All these things are important. Then it will help you to budget time and resources for the main instrument. I mean, for the main time that you go for the data collection, and it will help you to revise the instrument after you must have done the pilot testing, to add what you need to add and remove what is needed to be removed. Then the next one is misunderstanding reliability and validity. Misunderstanding reliability and validity. When you don't know what is reliability and what is validity, or even if you know them and you don't know how to apply it, or even how to calculate it, it's actually an issue. So misunderstanding reliability and validity, the problem here is you are confusing the term or treating them as an afterthought. You thought reliability is validity, and you thought validity is reliability. So that's another issue that we have, or we face in data collection. When you calculate reliability, you don't know that it is reliability. You thought the figure is validity, so you misunderstood. So then you now be very sure that my instrument is reliable, not knowing that you just calculated the validity. So reliability is about consistency. Can you reproduce the measurement? While validity is about accuracy. Are you measuring the right thing? So that is that. And for you to do validity, content validity index, you give it to people who will check the concept within the instrument and see that, okay, the concept within this instrument, they are measuring the right thing that this research topic is out to find out on. Then reliability, which is consistency, you calculate it. Maybe you do test and retest, then you calculate statistically and ensure that the value you have should be either 0.7 or above. So that is that. So an instrument can be reliable but not valid. So that is one very important thing. So some of us think once you have a reliable, or you have a Kronberg alpha of 0.70 above, you are good to go. You will not test the validity. It can be reliable but not valid. Yes. And validity is very, very important because it's talking about the content. And if you get it wrong on the content, then you are going to get it totally wrong on what you get from the field. So that is one thing. So you should make sure that both your reliability and validity are correct. So a reliable scale, consistently should give a very good output. That is a reliable instrument. The output should be at least 0.7. That is the value, and it will give that kind of instrument. Why we say it's consistent is if you use that instrument here, whatever you get, if you administer that instrument, that's on a group of students. Let's say you are working on student and you calculated the reliability of your instrument that you want to administer within those students, and the reliability gives you a very higher value. Whatever you are measuring here will be consistent, with maybe some other study somewhere that is going to be done on similar population. That is consistency. So that instrument will be consistent. Okay? Why validity? The content talks about the content of this instrument measures what I'm actually thinking I want to measure. So that is the accuracy. So the two, you can see that the two are very important. Consistency in the sense that I've designed an instrument. If somebody wants to use it in their own local setting, can that instrument be consistent? So that's another thing. So, and once my value is higher, it can be consistent, it can be used. So the content is the content going to measure exactly what I'm out to measure? And if the person want to maybe reproduce or replicate this study on another setting, in another setting on a different group of people, but of similar character with those I have done my study on, is the content of this my questionnaire going to be very, very accurate for them too? So those are some of the things we usually look at. So we shouldn't miss them up. That is both reliability and validity. Then another thing is practical hurdles in data collections. When you have hurdles in data collections, you talk of low response rate. If you had gone out for, let's say, pilot study, you will discover all these things beforehand. So these practical hurdles, low response rate, you use, people and your respondent their response rate is very low. That's another challenge we face during collection of data. Most times, people used to give incentives. In research, we call that inducement. It is acceptable or it is permissible. You can induce your respondent by giving them something so that they will be able to give you the information you need. You understand? It is, if you discover that during your pilot study, the response rate is very poor, and you still want to carry out your study on these people, all you need to do to solve that problem is what? You can just go with incentives, okay? Or you ensure that your questions are concise, straight to point, so that they can respond. You can give them incentives, small things to encourage them, or you can make the question to be concise, so that they don't need to stress themselves. They can just see and respond straight to the point. So another practical hurdles that we normally face is, missing data. Here too, it talks of which is very clear. You don't need to have any missing data. Missing data is about your respondent not, responding completely. If you have an instrument that somebody tick, maybe you have 20 questions and they now tick 15 and left 5, that is missing. Okay, those information are missing. Understand? Maybe because the way you design the question is very ambiguous, it's not clear to them. So, and the person don't want to tick what he or she is not believed on. He wants to, whatever he wants to tick, he wants to tick the right thing, how he feels about that thing. But your question seems very ambiguous. So such people will leave that kind of part of the questionnaire or the instrument. They won't tick or they will not respond to it. So that's will automatically be missing. So that's another thing. So what you do to solve that problem is you ensure that you design the instrument, the questions clear in simple terms that they can understand what you mean. Then you can also train your data, those that will help you to collect data, that is your research assistants. You train them so that they should check whether the instrument was or is properly ticked. Or even you, if you are going to retrieve your instrument, if you give if you give individual person, before you retrieve it from them, finally you check if they tick everything. So if they tick, you put it inside your bag. If not, you tell them, oh, these questions are not ticked. If you ask why, they may tell you, then you will explain to them and they will tick. So that is how to solve the problem of missing data. Okay, then sometimes then the next thing is participant burden. You here you should respect time. Time is money. No one will sit and tick an instrument for the next 1 hour. So time is money. So try and make sure that what you are collecting, they are only the essential information you are collecting. You are not just collecting everything. So streamline your questionnaire to ensure that the data you are collecting are essential data, essential information, so that you respect their time as well. Then clinical setting challenges. This one is all about you building a relationship with the staffs. That is, if your study is in a clinical setting, or you can also have a backup plan as well. So backup plans on how to solve some of these challenges that may come up during your data collections. So ethical consideration in data collection is the next thing. Ethical consideration in data collection. Research. In research, ethical consideration is very, very important. You can't just come and force me to do what I'm not ready to do. So we are going to look at just this informed consent, confidentiality and anonymity, then minimizing harms, and then role conflict. Now, informed consent, the word informed consent, you should tell your respondent, this particular information I want to collect, this is what I will do with it, this is why we are collecting it, and this is the reason. So if they now see, maybe after you explain, that's why it is informed, not just consent, informed consent. You have to inform them the reason behind your action so that they will understand. So at the end of you explaining, educating them reason behind your action, if they now agree that they will participate, most time is usually as advice. We advise that, or it's advisable that you give a document where they feel it's just like consent form. They fill and tick and sign that they actually give their consent to participate in this study. So, but in undergraduate, we usually say verbal consent and verbal consent somehow. So, but it is the standard is that you should do a written consent where you have a document to back up your study. Because if you want to publish some of these studies, some journal will request for some of these documents. So that's all that. So you should ensure true comprehension. That is true comprehension. You explain to them, explain to them why. Don't hide any motive, any reason why you are doing that study. Let them know. So let them know that you may end up publishing it. That is very important. So that is ethical issues as regard to the participant or the respondent. Then confidentiality and anonymity. Here, you should be able to explain to them that whatever information they will give will be treated as confidential. You're not going to reveal their name or their identity. All you need is some information from them and nothing apart from that. Then they will remain anonymous. Nobody will know that this information is coming from them. So you are going to ensure that, So you as a researcher, if you come to me and maybe you are doing a research on HIV, for instance, and you ask me if I'm positive and I responded, then you carry out the information I give to you, then you expose that to someone very close to me. You have breached this particular aspect of ethical consideration. So my information should be confidential and you should treat everything about me as anonymous. Okay. Then minimizing harm. Some research are usually invasive research where you need to take blood sample, you need to Either you need to invade the body, that's you do a little bit of invasive procedures and things like that. So if you have such kind of research and you actually want to do those research with human participants, you should try and minimize the harm. Not just only invasive research, even those researches that are not invasive, you can minimize harm. Like, okay, you shouldn't keep people waiting for long because they want to fill your questionnaire. Those are emotional aspects. You understand? There are also going to be harm on them. You understand? Or where they will come and meet you for collection of maybe you promise them to meet, you promise them that you people will meet somewhere. Let the environment be a very safe environment. You are trying to minimize harm on them. This one is just on sensitive topics. Sensitive topic. Even if it's not sensitive topics, you should minimize harm. Let's look at it this way. You want us to you want to collect information from us. You want to collect data from us. We are your respondent. Or you want to do interview for us. Then you ask us, or focus group discussion. Then you ask us to come to an environment that is full of danger. You have not actually done anything regarding minimizing harm. Now, we're talking of emotional harm too, and psychological aspect of humans is also one thing that you should minimize. You can't keep people waiting because they want to, uh, they want to answer your questionnaire. They want to go, you just hold them, you say, please. So they should do it at their own liberty when they are emotionally and psychologically uh, uh, ready to do it. You understand? So these are harms too that we are, inflicting on our respondent or participant that we don't know. So you as a researcher, you should know that you should try and minimize it. Don't just because you are under tension, you have few days to submit your study, then you are forcing them to take what you've given them. So at the end of the day, or if you look at it under ethical consideration, you've not done anything. You've not considered that aspect at all. So at most time you can explain all those things in your study. Informed consent. How do you check that? Anonymity and confidentiality. How do you ensure that? Then how do you minimize harm to your respondent or participant? You understand? Then how do you deal with role conflict? Your role as a researcher and your role as a nurse. How do you deal with that aspect? How do you checkmate them? Were you out to collect your information specifically, or you did it because you you are a nurse, you are there and you're trying to also give nursing care? So these things are very, very important. Role conflict. As a nurse, you may be tempted to want to begin your nursing or clinical care in the field where you are collecting data. You've forgotten that you are there as a researcher. So please, our roles should not conflict with each other. So the path to high quality data. How do we get high quality data? One, how do we get high quality data? High quality data, you align your research questions. You align your research question, your design, your method, and instrument. You have to align it. That is how to get high quality data. Your data must be of very good quality before your findings will be trustworthy and will be reliable. So you align your research questions with your design. Let's look at, okay, if your design is tilting towards qualitative study, your design should be a design that look upon qualitative study. And if most of your questions are tilting towards quantitative study, your design, which you will use for your study, should be a design that is also tilting towards quantitative study. So those are very important things, and they will help you, to also design an instrument that will collect the data that you want to collect. So that is how to get quality, a high quality data. Then secondly is you treat pilot study as pilot studying. If you do not negotiate pilot studying or pilot testing, at the end of the day, you will get a data that is of high quality and it will be very reliable. Then the validity and reliability of your tools underpinning the entire study should be credible. Your validity, that is content validity index, should at least be 0.80. Your reliability should be at least 0.70 and above. So those will ensure that the data you collect at the end of the study will be of high quality. Then you have to plan for practical problems to ensure smooth data collection. So those practical problems, you get them when you go in for pilot studying. When you go for pilot studying, you know that, okay, these problems exist. How can I tackle this problem? So pilot studying will help you to see the problems. Then before you go for final data collection, you work on those problems, you plan for those problems, and they will help you to the pilot study will help you to see the problem, and then when you see the problem, you plan on how to solve the problem at the end of the day. So then you can go and collect your data smoothly. So at the end of the day, if you do all these things, you will discover that the data you will collect will be of high quality. The data you collect will be a very reliable and credible data. You understand? So that is how to get a very high quality data. Align your research questions, your research design, your method and instrument. Treat your pilot study as not something to negotiate. Then plan for practical problem and ensure the psychometric properties are very credible. These are the references for your further reading, and thank you for listening, and God bless you all.